One thing that really stood out on your list was health systems starting to prioritize digital access when it comes to care and collaboration with big tech. Why do you see that being a prediction for you?
Well, I think it's what everyone expects from every other service they have in the economy, that they expect to be able to get on their app, be able to make their appointment, be able to really do that the way they do with all the other services. And healthcare is finally waking up to that. So we're seeing this big revolution in the digital front end of healthcare, where all folks really want to do is they want to be able to figure out who their doctor is, what's wrong with them, and do it in a couple of clicks.
Who have been some of the biggest disruptors, and do those disruptors continue in 2020?
Oh, there's a whole list of them. I think everyone wants to do healthcare. We're seeing, the Walmarts of the world are in healthcare. Amazon is in healthcare. Plus, there are a lot of startups that are kind of looking at particularly the ambulatory space to see what they can be doing in healthcare. So I don't even worry about my traditional competitors anymore. I really think about all of the electronic startups that are around us. And what we've figured out is that we've got to be able to partner with those and create that digital front end that it makes it easy for our 13 million customers to get in touch with us.
So do you view Amazon's early entry into this race as a threat or a very good motivator?
That's a good one. I think both. I think both's the answer. And there are going to be certain things we're going to do with folks like Amazon. I think what we saw in our Microsoft arrangement was that they really wanted to help us make healthcare better and not necessarily compete with us in our core business. And so that, for us, really made a lot of sense. And this comprehensive relationship that we have looking at what the healthcare hospital or healthcare spot of the future looks like is something that we're both working on together.
You know, Rod, the big thing when you talk about healthcare and technology is data privacy and holding on to that sensitive information. Are health systems prepared to work with big tech on data privacy? And then I guess I wonder if big tech as well is doing enough to protect healthcare data.
You've said it perfectly. I think we're very worried. The one thing that our patients trust us is with their data. And they don't want to see us giving away their data to someone else and it's being out there, being utilized for a whole. So we've been very protective about that relationship. So we're really looking for tech partners that are going to understand that. And we think that the difference is that the consumer really has to be in control of their data, and they have to be a partner in this. So it's not like I'm going to just give up my data and hope that something happens. I think the consumer wants to be a partner in this data transfer and understand what protections they have in giving that information over.
How do you see voice assistants working within the health system?
Well, I think, one of the biggest problems that we have today, if any of you have gone to see your doctor recently, most of the time they're head down on a mouse or a keyboard and not making eye contact with you. We think ultimately voice activation and being able to get information through voice is going to be critical, particularly for clinicians, because their biggest complaint, if you go to a group of nurses and doctors, is about the electronic health record, and particularly about them having to be data entry clerks. So things like voice activation are going to really revolutionize the way that tool works. But right now, it's too clunky. It's both a dissatisfier for both the patient and the doctor. And I think voice activation is one of those things that's going to make it better for the clinicians that are out there.